You're listening to Modern Intimacy, a show about mental health, sex, relationships, and the private things we need to talk about more publicly. I'm your host, Dr. Kate Balestrieri. As a licensed psychologist, certified sex therapist, certified sex addiction therapist, and PACT trained couples therapist, I help people live more fulfilled lives by shattering stigma, erasing shame, and building connections. It's no secret that we live in a society that compartmentalizes mental health and sex from our everyday lives. On this show, we're going to change that, and we'll do it by getting curious together. In this podcast, I'll invite you to join me as I investigate the relationship between sex, mental health, relationships, and modern society. In each episode, it's my goal to provide safe, smart, dimensional, and practical answers to those complex questions you've been wondering about. Head on over to modernintimacy.com/podcast for show notes and resources, or to submit a question or topic you'd like me to explore in future episodes, as well as to find all the links to follow us on your favorite podcast apps so you don't miss an episode. Don't forget to follow me on TikTok and Instagram at Dr. Kate Balestrieri for daily tips on how to improve your mental health, sex, and relationships. Everyone has questions. You are not alone. On this show, I make information accessible because everyone deserves to have more integrated, healthy, and sexually satisfying relationships. Thanks for joining me. Let's get started. Well, thanks for joining me today.
Thank you for having me. I appreciate it.
Yeah, it's an honor. It's an honor to meet you. I've really been appreciating your work on TikTok, and
appreciate that.
Yeah. So tell me a little bit about what you do and how you got here. I understand you recently moved to LA.
Yeah, so I moved here about 4 months ago. At the top of the year, and I came from Virginia, Southern Virginia.
Mm-hmm.
I was working, in an inpatient state hospital, doing forensic psychiatry out there.
Mm-hmm.
And before that, I was teaching at Adhd University, and that's where I got my doctorate degree. I have a DNP, which is a Doctor of Nursing Practice, with specialty in mental health and psychiatry.
Okay.
And my goal was always to, to help people out. But as time went on, I, began to learn about social media and how I could go from, teaching students at the university, to teaching my patients who, were under my care, to teaching people online. As I fooled around with the platform more and more, I realized that people were hungry for information.
Yeah.
And, the information is there. You can go online, you can go to YouTube, WebMD, up to date. Like you can go and find evidence-based information online.
Mm-hmm.
But I realized that the way that people were, disseminating the information, it wasn't like in the language of the majority of people who want to take in information. So I just put out what I know, using like the trends and things like that, and people were like, okay, I understand it.
Mm-hmm.
So once I started to do that more and more, I realized that there was a need for it. So
Mm-hmm.
I'd always wanted to come out to Los Angeles, and I figured that there was no better time than now. I don't have any kids, not married, nothing like that. So this is the perfect time to, in a sense, gamble. We're in the middle of the pandemic. Hopefully we're towards the end of it, but this is a good time to reinvent yourself and prepare for like a whole new world. So that's what brings me to LA, and I'm excited to be here.
Well, welcome to LA. It is.
Thank you.
It's an interesting city, and definitely one that is even more interesting to move into during a pandemic. So,
right.
Yeah.
While everybody's moving out,
Yeah.
So.
Yeah. We'll check back in 6 months when the world's online and see how you like LA then.
Yeah.
Yeah. Well, I wanted to talk a little bit with you today about ADHD and sort of in general, and then how it impacts relationships and sexuality. Part of what I've really been appreciating in your TikToks is the information that you put out there about ADHD. And I see in your content that people are really hungry for this information. I think it's a diagnosis that's not well understood, and there are a lot of co-occurring diagnoses with ADHD, and then a lot of differential diagnoses that often get mislabeled as ADHD, or ADHD goes unrecognized. So maybe let's start. I would love to kind of understand a little bit about how you define and understand ADHD.
Okay. So, when people say ADHD, I don't even like the term ADHD, attention deficit hyperactivity disorder. I don't like the term because it's almost as if you read a name, it will seem as if you either can't focus or
Mm-hmm.
you're too focused on one thing. And in a sense, ADHD is that, but it's more so of you know an executive dysfunction, within the brain. Like you can focus on certain things, like and I tell people on my TikTok lives, like if you like, let's say you love video games, right? And you're really good at it and you have ADHD, chances are you can focus really well on that and excel at it for hours and hours and
Mm-hmm.
break records, make a lot of money. But the issue is with things that you don't like, or mundane tasks, or, like, balancing the checkbook or cleaning your room, like small things that we have to do every day that,
Mm-hmm.
if you don't enjoy doing it, of course you'll do it, but it'll take you hours and hours and hours to do if you have ADHD. So, and I was talking to my brother the other day, and he said, isn't everybody in the ADHD spectrum? And I do believe that we all have times when we might not be able to focus on things, or we're spaced
Right.
out. But with ADHD, there's significant impairment, that would happen, because of a lack of focus, or because you can't focus on a certain thing at a certain time, or maybe
Mm-hmm.
because you're, too impulsive, too hyperactive. So when I think of ADHD, I think of it as a disorder where, your brain is not firing the way that it needs to be firing. So everything, I don't say that, your brain is not wired correctly. It is wired correctly, but it's stronger in certain areas. In other areas where you would need your brain to, pick up the pace, you
Right.
can't quite, get your brain to get there. And because of, that, it can lead to things like you have issues in your relationships where you're missing, significant events like birthdays, anniversaries. You can be late to
Mm-hmm.
work. For teenagers, there's an increase of STIs, because of impulsive behavior. And like
Mm-hmm.
you said, with the differential list, it can look like mania as well. So that's why it's so important for people to be educated on it, and to go get psychiatric evaluation or neuropsych testing, to get the appropriate help that they need so that they can get the proper treatment. Because I believe that the treatment, if you treat it, whether it's through therapy or meds or a combination,
Mm-hmm.
which is what I would recommend, a combination of the two, it can change your life, because at
Yeah.
that point it can bring you to where you feel like you should already have been. And
Mm-hmm.
sometimes people are in the 30s and 40s when they get this diagnosis, and then like they have this moment where it all makes sense.
Right, right. Well, I really appreciate what you're saying because a proper diagnosis really is the first start in addressing
Right,
ADHD, if in fact that's what someone is working with symptomatically. And a lot of people will sort of throw around ADHD in this very
mhm,
colloquial way. Oh, I got distracted, therefore I have
right,
ADHD, and they'll sort of overestimate their
mhm,
symptoms
right,
and or think that getting prescribed a stimulant will help them, and then in fact it
right,
makes things worse because
right,
that ADHD wasn't the underlying condition. So I
mhm,
think it's important to really, take the time to get a thorough evaluation.
right.
Yeah.
I completely agree.
What are some of the sneaky ways that ADHD shows up? Like what might someone not know to look for?
So besides the traditional, things like, not being blurting out, interrupting people mid conversation, or, being in like spaced out for hours, I think you want to look at, for adults, for example, ADHD often presents as anxiety or
Mm-hmm.
depression. And it can happen because your brain is tired. Like you've been having to compensate for, not being able to get things done on time, or being all over the place, or having arguments with people. So your brain is like having to work overtime, and you're
Mm-hmm.
feeling anxious or you're feeling depressed because you don't know what's going on. And it wears down on your self-esteem, when you can't get certain simple things done. Like you can be a
Mm-hmm.
high functioning, high achieving individual. You could be a lawyer, a doctor. I mean, you could be somebody who is like regarded as one of the more talented people in society, but you might struggle with a simple task, and that can
Mm-hmm.
affect your confidence. It can lead to some anxiousness and some depression. A lot of times with ADHD, you often see individuals. You have somebody, for example, if somebody's in a relationship, you'll see somebody get to the point where, we talked a little bit about rejection sensitivity
Mm-hmm.
dysphoria, where like you might have an argument and somebody might say something that in their opinion is benign, like, oh, you should have done this, but then you really feel it, like you're
Mm-hmm.
just a little bit more sensitive, and then you can resent that person, and then you say something else and that person didn't know that you were that upset about it. So there's so many different sneaky ways that people can pick up on ADHD. And another thing too is when you have to, a lot of times people with ADHD, they have anxiety over doing like a task which they think is complicated.
Mm-hmm.
So you might let's say you have to clean the back of your trunk, right? And you're thinking about it, and you're like, oh, I have to clean the back of my trunk. Let me push it off to the weekend, right? So you might push it back for like a month and a half, right? And then when you finally put your mind to it, you knock the task out within 20 minutes.
Mm-hmm.
But
Mm-hmm.
because you have anxiety over like a to-do list, you have this long list of things to do, and that's why I would say it's best to have a to-do list, but then a priority list. Because if you put
Yeah.
everything on a to-do list, you'll look through the whole thing, and you can spend hours organizing what you have to do. And when it's time to do it, you're like, okay, I'm done. you know,
Right, right. It's exhausting just even to think sometimes about how
right,
am I going to get to all of this. So that's a great idea,
mm,
really making that prioritization list. Now, a lot
right,
of what you're talking about is what I see in couples frequently
mm,
in session. Partners will misunderstand the behaviors of their other
right,
partner who has ADHD and personalize it sometimes, right? I've
mm-hmm,
asked my partner to load the dishwasher 3 times and they
right,
didn't get to it. And they internalize that as my partner doesn't respect me. My partner
exactly,
doesn't love me.
yeah,
My partner expects me to do all the domestic work.
right,
And that can be really frustrating
mm-hmm,
when it gets interpreted in that fashion. And both partners can walk away feeling frustrated
yeah,
and unseen and unvalued in those kinds of
yeah.
situations.
I definitely agree. And with couples, and I think that's why a lot of people have appreciated my content, because like I'll throw a symptom out there, and I've had people comment on my videos, and they'll say, thank you so much. I'm gonna send this to my wife. She thinks that I'm lazy or unmotivated, or I'm doing this on purpose. And
Hmm.
if you have one partner who doesn't have or understand ADHD, then it's very likely that they'll take the other partner's, actions as like, oh, you don't care about me, or you're doing this
Yeah,
intentionally to try and,
right.
piss me off or something like that. And the partner might just be struggling. And especially with men, it's hard for men to sometimes talk about what they're going through.
Mhm.
So instead of saying, hey, well, this is what's going on, they'll just say, you know
Mhm.
what? I'm not worried about it. And you just push it to the side. And then when the next argument comes up, you bring up the past, and then it's just a big, just a big blow up. So I think with
Yeah.
partners, it's very important to understand, like when one partner has it and the other partner doesn't have it, so that way, because if you don't understand, like I can see how the relationship will appear to be like you know, it can turn to that codependent cycle, and you can have it to where one partner feels like they're almost like a parent to the
Right.
other partner, because
Mhm.
they're like, oh, you have to do this, you have to do that. Oh, so
Mhm.
I have to tell you to pick up after yourself. But and the other partners had like they're in a whole different like world. They didn't even know that what they're doing is impacting the relationship like that.
Right, right. So in situations like that, and I'm really glad you brought that up because it really does create a disparity sometimes in the
Mm,
relationship where one partner feels like even if they understand the ADHD, if their partner's not able to make accommodations or make
right,
some strides and get some containment around their symptoms, then they're sort of left holding the bag, and
right.
that can bring up a lot of resentment as well. So,
Mm.
what would you recommend to somebody who has ADHD and does struggle to sort of keep up with their share of whatever the household stuff is, and it's impacting their relationship, right? How can they show up or communicate with their partner effectively?
So the one thing I would say, and this goes for my guys as well, because as guys, we don't speak up enough. But if you're the partner with ADHD, my recommendation is that you advocate for yourself.
Mm-hmm.
I believe the closed mouths don't get fed. If you don't speak up and say, hey, I have this, like I went to a professional, I was diagnosed with this, they recommended this type of therapy or this type of medication, and this is how my life is. Like I would say, be as upfront as possible and say, hey, I struggle with this. It's kind of like when you you start a business, and if you're good at like balancing the checkbook, or you're good at recording, then you'll do that. But then your partner might be the one who's behind the camera. The
Mm-hmm.
goal is to, because if you're in a relationship, you're in a team. Think of it as
Mm-hmm.
you're playing for the same team. So when an issue comes up, it's not, you versus them. It's we versus
Yes,
this issue. So
exactly.
don't take sides and say, oh, I have to be right, or no, they're always wrong. It's more so of, hey, we're on the same team, and if I'm the quarterback and you're the receiver, or you know like whatever role you play, like this is what I'm going through, and this is what I struggle with. So because of what I have, it's not an excuse. Not that I don't want to wash the kids or do the dishes, but it's difficult for me to do these things. But at the same time, also bring up a solution. Because
Mm-hmm.
it's empowering when you take accountability for who you are, and what you do. And I don't believe any mental health condition is a reason to you should never use mental health condition as an excuse. And one thing I try to do with my patients, I always try to empower them, because
Mm-hmm.
just because they're living with a certain condition doesn't mean that they can't do certain things. I don't want to
Right.
strip them away from, you know, uh, accountability. So
Mm-hmm.
come up with a solution, say, hey, you know what, I'm not good with this at all. In fact, the dishes that would take you 12 minutes, it'll take me 2 hours. So how about you do the dishes, and then
Right.
I'll change your oil, or let me wash your kids, or I'll do this, or maybe say, you know what, I'll do the dishes because you need a break from the dishes, but let me do dishes in the morning. I'm a morning person,
Mm-hmm.
and,
Mm-hmm.
and I tell people, when people ask me, I believe that everybody has a time, throughout the day where you're just a little sharper than
Mm-hmm.
the rest of the day. So if we say you're a morning person, you're a night person. If you're a person that you're very productive in the morning,
Mm-hmm.
and you have ADHD, I would say schedule the tasks that are the most complex between those hours. So if you're on fire between 6 and 10 a.m., and you do really well during that time, I would say make sure you schedule your tasks that are difficult between 6 and 10 a.m. So if you
Yeah.
have a hard time doing the dishes or doing certain things, do them around that time, because everything else that you could do like passively, you can do it throughout the day when you're just kind of like not actively trying to use and exercise your brain.
Yeah, yeah, I really like that. I like what you're saying because I think sometimes people get sort of stuck in
Mhm.
some learned helplessness or perceived
Yes,
helplessness,
yeah,
right?
yeah,
And that could be the person who has ADHD or doesn't. But in a relationship, it is really imperative that two
yeah,
people understand, okay, these are the strengths and limitations of this partner. These are the strengths and limitations of this partner. And together, let's develop and brainstorm a way that we
yeah,
can divide and conquer so that we are maximizing each other's strengths and not shaming each other for
yeah,
weaknesses or limitations because again it can be really hard if one partner is holding the bag on
yeah,
everything. And certainly there are lots of other things that people can do to outsource tasks or bring in
right.
support for their relationship, and that can be a really helpful solution too and keep partners on the same team.
I agree, and it's all about being, self-aware, and a lot of times it's one thing to lie to other people, but it's something else to lie to yourself. Like if you know that
Mm.
you struggle with a certain task, or you just don't enjoy doing something,
Mm.
then that might be where you should spend your money. Like
Mhm.
I had to move to the other side of town, and my brother came from Georgia to help me out, and he's setting up certain things, and he's good, like he's a handyman in a sense. But then
Mhm.
sometimes I'll say, okay, you're a college student, you have finals, I'm running my business and all this extra stuff. We can pay somebody to come and
Mhm.
do what it would take you 4 hours to do, and then
Mhm.
they'll do it in 30 minutes or 10 minutes. So it's about speaking up for yourself. And if you're in the same team with somebody, understand that, hey, the quicker that you can go and get evaluated, or the quicker you can speak up for yourself, you
Mhm.
can put a name to what the other person would take as being like a lack of respect, or laziness.
Yeah, yeah. Well, you touched on something really important, and I think some of what gets in the way of people articulating what's going on for them is that they don't know, And the other thing that, they don't know what they're going through, but they know that
Right.
there's something going on. So they don't have the words or the vocabulary yet
Exactly.
to describe it. The other element I think that really gets in the way of people advocating or talking with people about it is shame, right? And
Yeah.
we
Yeah.
have this message in our world that if someone has a diagnosis of this or a diagnosis of that, that somehow it means something about the quality of who they are as a
Yeah.
person, and it just doesn't. But I think for anyone listening, if something feels off for you, this is nothing to be ashamed of, because most of us have things that we deal with. And, even people who are really, really high functioning out in the world they've
Yeah.
got stuff. And when we can start getting really honest about that, we can learn different skills and different ways of adapting so
Yeah.
that those issues feel less big and less loud in our lives.
Yeah. I love the fact that you said that, because nobody is perfect, and
Mm-hmm.
some people happen to be addicted to, like, substances that will ruin their life, and other
Mm,
people might be addicted to, things that are more benign, that you can kind of fly under the radar, but that's still their
mm-hmm.
private struggle, so you don't
Mm-hmm.
want to let shame people for anything. And
Right.
at the same time, living with shame, it can be devastating,
Mm,
because you might feel like you're less than, like, you're not if you're not able to disclose to your partner that this is, part of your everyday life. I think that's where you have the issues, because
mhm.
some people, because of the shame of ADHD or a diagnosis, some people would rather just let their partner assume that they're lazy or disrespectful, and they'll take that out, versus,
Mhm.
saying, hey, this is what I'm going through, because they would rather be seen as lazy, and then they'll just try and work harder to, pick up the pace, as opposed to letting them know that I actually have this, or I'm going to
Right.
therapy for this, or I'm taking the medication for this, because
Mhm.
they associate, going to therapy or taking medications with being, crazy. I hate that word, but
I
that's what
hate that word
they
too.
associate it with. So if you're not able to be upfront, then you're gonna
Yeah.
put yourself in a position to where you're under so much, you're frustrated all the time, and
Mhm.
then that can make you more anxious, and that's not going to help out with what you're going on, what's going on with you. So being upfront
Mhm.
and being able to say that, hey, this is what I'm going through, and being able to live in the open, and
Mhm.
that's why a lot of my content is aimed at trying to reduce the shame,
Mhm.
because everybody is going through something, but we became so good at hiding what we're going through, to put on this image of perfection.
Mhm.
And some of us are able to, somewhat make it, but the other people who can't make it, you'll feel like, okay, I'm not good enough, because this person that I look up to,
Mm.
they're perfect, but I'm here and I'm struggling. So I'm not as good as them. But the
Right.
person who's up there says, hey, I'm going through this as well, and this is how I got
Yeah.
through it. It's like, it makes that person like human, and we're all
Mhm.
human, and we realize that, we're all struggling with something. And if you're
Mhm.
the partner, with ADHD, maybe your partner might have ADHD. Like, after, like, you speak
Yeah.
up and say, I've been going through this, then they'll say, oh, well, you know what, I might want to get checked out. Or it might not be ADHD, but it might be anxiety, or, you never know. But when you live without shame, that's one of the most fearless ways to, to live. And that
Yeah.
will inspire the other person to, to advocate for themselves too. And I think that's like a better long-term solution to keep a relationship going, as opposed to trying to, you know, like, act as if you're somebody who you're not.
Yeah, I agree so strongly, and I really appreciate what you said about how some people would rather be perceived as lazy or
Right.
disrespectful, because
Mhm.
that is better in their mind than being perceived as weak or being perceived as
Exactly. Yeah.
having a deficit of some sort. And I really want to emphasize how that does give people an illusion of control over
Yeah.
their symptoms, right? I would
Mhm.
rather be perceived in this way that suggests I'm in control of my behavior than in this way where I really feel like I don't know what to do and I'm lost and I'm scared, right?
Mhm. Yeah.
Right. Yeah.
It almost sounds as if you, like, I mean, to somebody looking on the outside, from the outside looking in, you would say, why in the world would you rather be perceived as, being that, over having like a diagnosis? But
Mm-hmm.
it's not until you're in that person's shoes. And a lot of times, if you're in a relationship where you can't be yourself,
Mm-hmm.
It makes it that much harder to, speak up and let them know what's going on.
Mm-hmm.
So I believe so many people are living like this, so when they see these videos, they feel seen and heard and validated. And I think a lot of people will send their partners, my videos, or somebody else who's talking about the same thing on TikTok or Instagram, because they want their partner to validate them the same way they were validated by them
Mm-hmm.
watching that video.
Yeah.
And it's a good feeling because it makes you feel like, okay, I'm regular. I'm human.
Mm-hmm.
There's nothing wrong with me. I have this condition. This condition doesn't have me.
Oh.
There's a big difference between, like, you have it, but it doesn't have you. Because if it has you, then it runs you. But once you have it, then
Mm-hmm.
okay, this is what I deal with. But I'm not gonna let it, distract me from doing what I
Mm-hmm.
do.
Yeah.
And a lot of times, people with ADHD are gifted, they're talented,
Mm-hmm.
and
Yeah.
if you know that you hyper focus at a certain time, if you designed your life to where you know you hyper focus with this, you can put out a great project or a book or album, or you can run your business in the way that your business is successful. Because when you hyper focus on one thing and you, in a sense, neglect everything else, your team or your partner is taking care of everything else because you've told them that, hey,
Mm-hmm.
I'm not able to deal with X, Y, and Z.
Mm-hmm.
So it's important to confront it head on, and don't just let it be something that you want to. You can't outwork your ADHD. I don't think you can.
Yeah.
You can thrive with it, but you have to, admit this is going on and get the proper help, and put yourself in an environment to where you can thrive. But
Yeah.
you don't want to just do it alone, if it makes
Right.
sense.
Right. Yeah, that's really great. So let's talk a little bit about medication for
Mhm.
ADHD. What are some of the most popular and prevalent medications, and what are the implications of those medications or side effects that are, likely?
So with medications for ADHD, I mean, at least the way I learned it in school, I believe that the stimulants are some of the most effective medications in all of
Mm-hmm.
psychiatry. Because, with psychiatry, it's interesting because you have, for example, the antidepressants. Sometimes they work 30 to 60% of the time. I've seen studies that have that number anywhere from 30 to 60% of the time, and they're not even the most effective thing for depression. That would be ECT, which works much faster. But then there's a stigma with that, and there's so many medications that you have in all of psychiatry. But when you look at, you know, for example, let's take, diabetes. When you take medication for diabetes, it helps you out, right? You take your
Mm-hmm.
metformin, your insulin. It's effective at treating that thing. But with psychiatry, it's hard to find a medication that treats that thing.
Mm-hmm.
And with the stimulants, I believe that they are among the most effective medications to treat what they're supposed to treat. So sometimes it doesn't work for everybody, but with the stimulants, because they increase certain neurotransmitters in the brain, it helps you with executive functioning. So if
Mm-hmm.
you're spaced out, or if you have like 100 tabs open, then you're cooking downstairs, you have the washer and dryer going, and then the kids are like running in a circle. It can help you focus on one thing. So the
Right.
intended effect is, take like Adderall, for example, like mixed amphetamine salts. It will help you, or it's supposed to help you focus on one thing. So you start this task, you complete it, you're done with it, you put it to the side, you go take care of the kids, boom, 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 you do that, you move on.
Mm-hmm.
You do things sequentially versus being all over the place and just kind of, not taking care of what you have to take care of. So the issue with the stimulants is that, they're widely abused.
Mm-hmm.
You don't have to see a professional for it, because some people, and I'm on TikTok, so I see the comments. People will go grab them off the street.
Yeah.
You can go to a
Which is
college campus.
not recommended for
Right.
so many
It's not
reasons.
recommended. Yeah. I
Yeah.
tell everybody on my TikTok live, don't take anything that was not prescribed to you by a licensed professional. I
Right.
make that very clear. And
Mm-hmm.
don't start or stop taking stop taking anything, if it's not recommended to you by your professional, because
Mm-hmm.
they'll go online and say, oh, I think I need to double up on this, or maybe take half. No, just take it exactly as it was prescribed.
Mm-hmm.
But with the stimulants, you have, Adderall, Vyvanse, you have Ritalin,
Mm-hmm.
methylphenidate, and then you have non-stimulants as well, like Strattera, which, if you're concerned about the potential for abuse, you can try that. And there was another non-stimulant recently approved. I think it's called Quellbreed. I need to read up on that one, but it works similar to Strattera. So there's different,
Okay.
or sometimes people will use Intuitive or Clonidine, which is a blood
Mm-hmm.
pressure medication. So the thing that I want people to know is that they are medications to treat ADHD, and they're not always stimulants. In my personal opinion, I believe that the stimulants are the most effective thing that we have for ADHD.
Yeah.
Like I've seen patients who, their grades were sinking, their lives were in disarray. And when they got the proper medication, like a stimulant, and then they got therapy that helped them realize, what was going on in their life, like it made a world of difference. Like
Yeah.
it was life changing, I
It
believe.
is. It can be so transformative and so grounding and integrating for people whose symptoms of ADHD have kind of left them feeling really scattered, right?
Right,
And sort of all over the place. So the proper treatment really can help everything feel like
right,
it's in its right place internally.
right. It can be a
Yeah.
huge game changer.
Yes, yes. Are there any side effects of those medications that you mentioned, the stimulants and the non-stimulants, as it relates to sexual function?
So with the stimulants, a lot of times the main thing that you'll see, like you have people who lose their appetite. It can activate you, so it's hard to sleep at night.
Mm,
So I've seen people abuse the stimulants to where they want to like have sex on Adderall, um, because you're getting dopamine from sex and you're getting dopamine from Adderall. So you want to have this amazing sex, and I mean, just take your meds as it prescribed. But a lot of people haven't seen too many people complain of like sexual dysfunction
mm-hmm.
from the medications. A lot of times you might have like a paradoxical effect. I've seen that to where people will take the meds and instead of them being more activated and focused, it makes them sleepy.
Mm,
But in regards to like sexual dysfunction, I see that I've seen it more with the antidepressants, if anything. I
yeah.
haven't seen that too much with the stimulants, but I've
Mm-hmm.
seen people get like a rush from the medications, and then you get a rush from sex, obviously. But I haven't
Yeah.
seen too many complaints sexually from the stimulants.
Okay, that's great. Great. Is there anything that we haven't talked about related to ADHD that relates to relationships or sexuality that you think it's important for us to focus on?
Yes, I think it's one thing that had crossed my mind. A lot of times with people being people who have ADHD, because your brain is going at a rate that your brain needs stimulation in the way that you want to be stimulated, right? So
Mm-hmm.
like I say, if you love to go horseback riding or video games, like your brain wants to be stimulated that way.
Mm-hmm.
So a lot of times with people who have ADHD, they get bored with certain things. So sometimes you see that's why they might not want to be in monogamous relationships, or they're in a relationship with somebody, but they might get bored sexually. And this is like a pattern that I've seen, and I think it's important to address because if not to say that ADHD should never be an excuse for cheating,
Right.
because whatever the when a person gets with another person, whatever rule you have, as long as you follow that, if it's an open relationship, polyamorous, like whatever you agree to, as long as you follow those guidelines, everybody's being respected. If
Mm-hmm.
nobody feels like they're treated out of anything.
Yeah.
But a lot of times you can have individuals who need more stimulation. So whether it's sexually or whether it's in other parts of their life, that's important to talk about. So if
Mm-hmm.
you are somebody who you feel like you need more sexual stimulation, it sounds uh, I think nowadays actually it's easier to have that conversation,
Mm-hmm.
but it didn't used to always be that way. It used to
Yeah.
be to where you might have felt like, okay, I need more sexual stimulation, whether it's with this person or we need to do more with this person, or whether I need to be with somebody else, or whether we need to be with someone else.
Mm-hmm.
I think there was a huge like stigma and shame just with having that conversation. So I think, and obviously like, sexuality is more so of your specialty. So I'm kind
Right.
of curious to see your thoughts on how people have been able to have that conversation. Because I think it's easier to have that conversation in 2021 versus even like 5 years ago.
Oh, absolutely, absolutely. And we are in this really lovely time in our world right now where we're more liberated than ever
Mhm.
sexually, and we're having more of those dialogues openly, which is great. And I really like what you said about just sort of recognizing the underlying needs that each individual person has as it relates to sex and sexuality, and setting that stage from the start of a relationship, because there
Right.
are
That's
lots
the
of other
thing.
people.
That's the thing.
Yeah, there are lots of other people who would be interested in an open relationship or polyamorous relationship, or inviting a third into the mix periodically, or finding other ways to introduce novelty into your sex life. And I think it's that novelty piece that a lot of people, I mean, really all humans appreciate novelty when it comes
Right.
to sex. I shouldn't say all, but most.
Majority, yeah.
And the majority of us like something new every now and then.
Mhm.
But that can mean a lot of different things for people. And it might be something simple like different music, or a different room in the
Right,
house,
right,
or a different sex toy that you bring into the mix. It doesn't always have to include another
right,
person. But if you know that that is your truth, then why even start with a monogamous context,
right,
right? You know,
right.
set yourself up and set your partner up for success by being open and transparent
Mhm.
about what you want. And that will allow for a more authentic, erotic experience in your life and
Yeah,
happiness relationally.
I completely agree. If you know, and that's why it's important to do check-ins with yourself and see how you're feeling
Mhm.
about things. Do I like myself? Do I like where I'm
Mhm.
going? Like, how am I mentally? Do I like this thing, or am I apprehensive about a monogamous relationship? Because if you know that you have some apprehension with it, then say maybe I need to evaluate how I feel before I, you know, get with somebody else, and this is what we've
Mhm.
agreed to. And like you said, it doesn't always mean another person. It could be a different room, it could be different music. And a lot of times people hear, like when you hear somebody who, let's say, they said they get bored, the first thing you think of is, oh, they want another partner automatically. It might
Mhm.
not be that.
It
You have to
might not.
figure out what that person needs.
Yeah.
Because if they need more stimulation, it could be a monogamous relationship, but they need different things.
Mhm.
So it's important to customize it to that individual, in my opinion.
Yeah, to that relationship or to that coupleship,
Right, right,
those two people who are being sexual, whatever their dynamic might be.
right.
Right. And I think if most of us got more open and more real, even though we are seeing an increase in transparent
Mhm.
conversation, but if more people were able to openly discuss what they wanted sexually without any kind of shame, I think more
Right,
people would be getting what they
right.
want. And more people would be feeling less betrayed, less
Mhm.
manipulated, less exploited. And it's
Right.
when we aren't transparent that those kinds of
Mhm.
relationship problems develop, and then that
Yeah.
just compounds and can make, can make for a really messy situation in someone's life.
Right. And I love the fact that we even spoke about this because, I think somebody came on one of my live streams and they were asking about, sexual liberation. And
Mm,
I said, yes, but the word I like more is autonomy for
mm,
every person, because it might not even be like you want to be sexually liberated. Maybe you want to see other people non-sexually, or, just the fact that we can have those conversations and give people room to either explore others sexually or non-sexually, or just for them to be in control of what they're doing. It raises your self-esteem. You feel like you're not being used. You feel like
right.
you have a say in how you choose to live your life, which is very empowering.
It
So
is.
I like the fact that we're making it okay for people to do that, and you don't have to take any side. If you don't want to do the polyamorous thing, you can be in a monogamous relationship. Find somebody. I say find somebody who wants the same thing that you want, and then go
Yeah,
from there. And it's
right.
important to start from the jump. This is what
Yep.
I want. I know this is what I want, or I'm not sure what I want, so I'm kind of going into this and playing it by ear. And then let them know, hey, this is kind of how I am, and
Mm-hmm.
I might get spaced out from time to time, or I might get bored from time to time. So I might think about this, or I've thought about this, and I've always wanted to do this type of thing, but I'm not sure if you'd be open into doing it. But just having constant communication, I feel like
Yeah.
if you have that, you really can't go wrong.
Yeah.
You'll have difficult conversations, and you have to be ready for that.
Yes.
You definitely have to be ready for that.
Yeah, I agree. Well, thank you so much. This was really a wonderful and robust conversation, and I'm so grateful that you took
I
some time
appreciate
to
it.
come out and talk with me about ADHD. Where can people find you if they want to learn more about what you do or reach out to you?
Sure. So once again, I want to say thank you so much for having me. I've been keeping up with your content on Instagram, and I do enjoy it. To get me, you can go to my website, www.kojosarfo.com. Keep up with me there and read my book that I released 2 years ago. But the place that most people want to, follow and keep up with me at would be on TikTok. So that'd
Hmm.
be, you go to TikTok and then just type in Kojo Sarfo, or you can put in at Dr. Sarfo. On Instagram is at Dr. Kojo Sarfo. So those are the three main places where if you keep up
Great,
with me there, you can see me anywhere on the internet.
great, great. I'll make sure to put all of that in the show notes so people can find you really easily. Yeah.
All right. I do
Thank you so
appreciate that.
much. Yeah.
Thank you very much.
Thank you for listening to this episode of Modern Intimacy. Follow our show on your favorite podcast app by going to modernintimacy.com/podcast. And while you're there, don't forget to enter in a question or a topic idea for future episodes. That's modernintimacy.com/podcast. This show is for educational and entertainment purposes only and is not a substitute for therapy or psychiatric care. Listening to this show or submitting questions or topic ideas does not constitute a therapeutic or professional relationship with Dr. Kate Balestrieri or any providers that work at Modern Intimacy. If you're having a medical or psychiatric emergency, please call 911 or go to your nearest emergency room. All opinions expressed by guests on this show are those of the guests only and are not necessarily indicative of those opinions held by Dr. Kate Balestrieri or staff at Modern Intimacy. Thank you for listening to today's show. For more episode information and helpful tips, visit modernintimacy.com or follow us on Instagram at @TheModernIntimacy or follow Dr. Kate on Instagram and TikTok at Dr. Kate Balestrieri. See you next week.